once heard Dr. Mark Hyman say that if your doctor prescribes you a medication without first asking about your diet, sleep, exercise, hydration, or any other stressors, you don't have a doctor, you have a drug dealer. Let that sink in. We need to be talking about the whole person, not just a few symptoms. I've said it before on Well Informed, and I will say it again now. Each and every body is different. Today, we are talking about functional medicine with my friend, Dr. Nathalie Bloom. Born and raised in Montreal, her undergraduate degree led her to corporate America before she found Nuka Chiropractic. She then pivoted and returned to school, where she received a doctorate in chiropractic. Along the way, she returned to school again for a degree in functional medicine and clinical nutrition. A doctor, a lifelong learner, a mother of 3 who lives in the Chicagoland area, an owner and practitioner at New Care Health in Northbrook. Is there nothing she cannot do? We are so lucky to have her today to join the conversation. And don't forget to stay tuned to the very end to hear our source and self speed round. Bonjour and welcome to the studio. Hello, Dr. Nathalie Bloom. How are you?
Very well. Thank you. How are you? Thank you for having me.
I'm good. I'm so glad you could be here today. You are just so full of knowledge on such a breadth of wellness topics. But today, I really want to dive deeper into functional medicine. Just basics. How is functional medicine different from traditional Western medicine?
So we, in functional medicine, we focus on the root cause, the why behind a problem or a
The
condition
why.
or an ailment. Most of the time in conventional medicine, they look at the what. What is the problem? What is the symptom? And they address the symptom, but they never really get to the why. And really, people come to me asking why. That's the biggest
Yes.
question I get. I get, why is this happening? Why did this happen? Why did it change? I was fine one day and I'm not fine the other. So we're really
Right.
talking more about chronic than acute conditions. And these are the
Okay.
conditions that, people kind of hit a dead end in when they go see their practitioner.
So, what do you consider when you first meet a patient?
So we look at lifestyle. So it's very important, just like you said, we definitely want to see what the person is eating. Is there, how much exercise are they doing? Like you said, hydration counts as well. And basically, I also ask the question, which is really important. Do you even cook? Does somebody cook in the
Do you
household?
cook?
Do you
Yes,
cook? Because that is also a reasonable question. Not everybody who's working full time, who has a family, has time to cook or knows how to cook.
100%.
And so that's
100%.
also a valuable question to ask, because when addressing food, everybody knows how much chicken or broccoli or whatever, salad to put, however, to put on their dish. I don't need to
Right.
tell them how much broccoli to put on their dish. However, it's more about the approach to what a day looks like. Do you have
Right.
3 meals a day? People always want to know about intermittent fasting. There's so many questions out there, which is suitable for some people, but maybe not for others.
Right.
So we really want to get to their lifestyle, and then stress. Stress is the
Stress.
boogeyman. Stress,
What
and we all
kind
have
of
stress.
stress?
So we all have stress, right, Abby? We all
I
have
think
stress.
every bit of stress, it gets you moving in the day. If a tiger's coming to get me, I'm going to run.
Right. So that is your cortisol. That's your adrenaline, right? You get this adrenaline rush, and you're going to run away from that saber-toothed tiger. That's fine. So, and that's what we're designed for. Is the stress hormones are there for danger, but now
Danger.
everything is perceived as stress, right? So how
Yes.
much perceived stress, that's what I call it, perceived stress, do you have? And there are some major stressors too. A lot of people right now, Xers, Generation X, we're in the sandwich generation. Have you
Yes.
heard of that term, the
Of
sandwich?
course.
Yeah. So we take care of our parents at some point, and we take care of our kids. And so we are being pulled in both directions. Maybe we work as well. Maybe we have a household, we have a husband. Maybe we don't have a husband. But either way, we are being pulled in many directions. So this is all perceived stress. Making an appointment on time could be a perceived stress
Yes.
as well, right?
Oh,
So
yes.
all this adds up. So stressors are that, but there are also the really big stressors in life. And so we do address that as well. And so that's just one part of stress, but there's also the physical stress if someone's been in an accident or injury. There's the
Yes.
mental stress as well. If people are having some other mental health issues. So there's different types of stress, but they all come back into the same pool. And that
So
wreaks havoc and can create inflammation, turn on and off genetic predispositions in the body, and wreak havoc with the body.
do you think each stressor is equal? Is mental stress versus a physical stress? Do you think they weigh equally when you're looking at a patient?
So, good question. Let's talk about balance, really. It's really a source of imbalance, isn't it? So,
Yes.
we it's all about finding the balance, I feel, and in people's health. And so let's talk about eating the wrong foods.
Right.
And so at some point, maybe you go on vacation, you eat the wrong food, you come back and you pull it and find the balance. Nobody's perfect.
Right.
Nobody needs
Nobody's
to achieve
perfect.
that.
Right.
But if you're going to do something, find the balance. Find the balance.
When I think of functional medicine, I think that the emphasis is on prevention as opposed to detection. And that to me is the biggest seller because we all don't know what tomorrow will bring. Do you think there'll be a time when American healthcare will fully embrace functional medicine and prevention? And is there a way that we could fold functional medicine and the prevention? I think that's the most important right now, because who knows what's going to happen tomorrow?
So that's it. So the definition of prevention, let's discuss that. So
Right,
prevention can mean different things to different people, including
right,
the medical field, right? So for them, prevention is an annual physical. And every so many years, a colonoscopy, a certain age, you've got bone density. That's their perception of prevention.
right,
And so, but most people, when you're saying it in the way I think I hear you say is, let's find the problem before it really becomes problem. Let's find.
right, right,
And so that's what we do. We connect the dots and we look at pathways and we look at a condition before it becomes a condition. We look at
right,
almost the clues that are there. Because if you see your doctor and you're just a little bit out of the range, you may not be a candidate for medication, but there may not be a
correct,
solution either. So they're
right.
just waiting for you to be so out of the range until they're ready to, again, treat that symptom and not really find out how it is that you ended up there.
Yes, I'm
Yeah.
always wondering, yes, I understand a cold and having the antibiotics that, come after and then it's gone. But sometimes it's like, why? I struggle with why.
Yes.
Was it something I did? Was it something I could prevent? If I'm, feeding my children X, should I not be, feeding them that, or what shall I do? That's the question I always want to answer because I would prefer to not pass along my bad, anything that would affect me negatively to them.
Sure,
Um,
sure.
um,
So, yeah, yeah. And sometimes you can see the almost what we call the a bit of the precursors, the aura, if you will. And so even in the body keeps score. There's a book called The Body Keeps Score,
the
right?
body keeps
And
score.
one of my favorite expressions is the issues are in your tissues. Your body's talking to you. Your
Yes,
body's talking
yes.
to you. And it could also be we people know they come in, they know there's something amiss. And
Hmm.
by the time they've come to see me for functional medicine, I am not their first practitioner.
Right,
They
right.
have seen other practitioners, but they know there's a missing link. They know that the source has not been, they're asking why. They're asking why.
Why?
And,
Finally, why? Why?
and so we
Because they're
have
not
tests.
getting the answers.
Well, the tests that we do are a little different, including I
Like
like to
what?
start for instance, I like to start with a generalized blood test, which you would get with your primary, right? Once a year. That's a common blood test, is something common to have, blood chemistry. But, we don't follow the insurance guidelines. So in many ways, we can go in many directions. So once you've done your intake forms and we've had a discussion about lifestyle, and family history and any ailments that are going on, current ailments, it guides me in the direction to pick the proper blood test. Yes, we will do the more conventional blood test, but we will also go in a few different directions um, to seek out anything that's been amiss. And insurance companies don't like that. They want you to stay in one lane. So you'd have to see many specialists to achieve almost this one blood test that is now done in one collection and tells a bit of a story. And if there's anything, and that's what I call the foundation, if there's anything amiss in there, if someone's really chronically fatigued, for instance, and doesn't feels foggy brained in the morning, and their general CBC doesn't really, hemoglobin doesn't really show much, but then all of a sudden I do a blood test and I see, wow, you are definitely anemic.
Right,
Now
right.
that's a biggie. If you're
Yes.
anemic and you're not sleeping, that's going to cause a lot of issues here. And that's oxygen to every cell in your body. You need it
Wow.
to get ATP, to get energy. And so
Right.
at a subclinical level, sometimes the ranges, when you see your conventional doctor, the ranges are so vast because they are decided on a bell curve. So when you get your
Right.
blood test, they just want to see what's in range, what's out of range. That is all your doctor wants to see. So he doesn't see if you're even 1 point within out of, close to being out of range.
Right.
We say you're going to function better in these optimal ranges. So we've decided
Optimal. I
there's
like that optimization.
Yes, that's what we use that term. We use the term in optimal range. We know that you will function better when you're in these ranges. And so maybe we've closed up the range. Maybe we've cut a little slack on some of the ranges.
Right.
And so it gives us more of an idea, a little bit more gets flagged in when we convert this blood test into our ranges. Some of it means something, and some of it just gives us, again, an idea of where the body is and how it's the foundation. If there's any precursors, anything building, anything happening that we need to treat. We actually call some of these, including some digestive issues, we call them our deal breakers. If something is
Deal breakers.
happening, at a systemic level, let's get to that first, and then we'll also tackle some of the more individualized sort of symptoms that people come in here with. But your foundation, that is, again, that balance, that foundation. I know for me and people who have been doing functional medicine for a long time, we go for that first. Does that make
Right.
sense?
Yes, it does. What I'm hearing, and I really appreciate, is that you are taking all the blood tests that I would be going to this specialist, that specialist, and another, and they would never take, I guess in psychology, like the gestalt, the whole
Right.
picture. And I feel like I want to line up a table of these specialists and they can all talk about me. It would be a great day.
That
But
would be a great day.
going to you, I would just get all the information and it wouldn't be so siloed. And it's almost, we're hurting ourselves because we're not seeing the whole picture. When I go to this specialist, they are very good at what they do and they know everything about their specialty. I think we're hurting ourselves. I want to move the conversation to inflammation. It's a big topic. I hear it all the time. Is it a major cause of health problems? And what do you think is the root of really an epidemic of inflammatory diseases?
So it's interesting because you said, is it a cause of major health problems? Yes. And it is the root cause, but it, it didn't start out of nowhere.
Right.
Right. So why does inflammation is almost opportunistic. It's not the inflammation that you would ice, like a swollen ankle. This is the
Right.
deeper inflammation that happens. inflammation is, again, something that, again, it is triggering to the body, and it's opportunistic. So when the systems are down, and that's why managing stress is
Right.
always a conversation I have with everybody.
When
And
you let
managing
down your
stress,
guard, it can come
yes,
in. Okay.
in whatever capacity someone's able. Not everybody's there to meditate, and that's wonderful if they do, but then take deep
Of course.
breaths. When
Right.
you deep breath in, that's your sympathetic system. And when you deep breath out, that's your parasympathetic system. You really take a long, deep breath. So we talk about concepts of that sort. Not everybody's into meditation. Please, if you want to meditate, that's one. I love that. But taking a
Right.
walk outdoors, that is also communing with nature. We
Yes.
we are constantly do, and it's part of the whole self-care, and that has now become such a big buzzword. But I kind of, again, this is where it becomes individualized for the
Right.
individual,
Right.
right? So if someone's got little babies at home, I've got to, again, individualize it for them and
Right.
give them
Right.
options. So what we do too, and that's the other thing, is we want you to be a partner in your healthcare. You
Yes.
are a partner, and you are an active partner, and that's what we're looking for. Nothing wrong with there's room in the med. And by the way, just a little footnote on our last question you had is, if there's a
Yes.
reason to refer to a medical doctor, I always do. And I always want
100%.
them to get another opinion, because even if they want to take the more natural approach, it's important that they hear the more conventional mainstream and make that decision for themselves. That's where they become also empowered as a partner and as an active partner in their healthcare versus, I've got this, here you go, let me tell you what to do, take
Right.
this.
I
Yeah,
do think they can go hand in hand.
absolutely.
I don't think
Yes.
it's a either or
Yeah.
situation. I feel like when you're looking at medicine, you do have to consider both because, only a hand specialist can fix my, broken finger.
Yes.
But I'm wondering, because I hear this buzzword a lot, autoimmune,
Yes.
and inflammation.
Yes.
Have you seen an increase in autoimmune conditions, or are we just recognizing them more? And how are autoimmune conditions and inflammation linked? And I know this is a multi-part, but they keep coming. I'm wondering, does inflammation have to occur for an autoimmune disease to appear? Or is it one, chicken or the egg?
So when we talk about autoimmune, it's such a broad spectrum. So are you talking about rheumatoid RA? Are you talking about
Yeah,
RA?
like a rheumatoid arthritis.
Okay.
Like,
So like,
would
yeah,
I always have that
okay.
predisposition to rheumatoid
Yeah.
arthritis? And then for some reason I was inflamed and that triggered it? Or how does that come?
Yes. So good question. RA, rheumatoid, which I do test a lot on people because by the time they've come to me, they may not have had it tested, which is very odd to me, especially if their body is, like you say, screaming of inflammation. Um, it is quite hereditary, including
Mm-hmm,
autoimmune thyroid or thyroiditis or Hashimoto's.
mm-hmm,
But we, just like type 2 diabetes, that could be also hereditary, we know now through diet and lifestyle changes that
right.
we could also either turn on, off, and manage um, some of these conditions.
Mm-hmm,
You may always be positive, but it may not be inflamed. So the fire might be out. And that's the key. The key is, why does one person with autoimmune have it raging and somebody
right,
who does not? Now, within the autoimmune, you've got the lupus and the Sjogren family. Like
right,
I always like people to rule the bigger ones out. And I do recommend that people do see a rheumatologist, or
right,
I do when that comes out positive, because again, that's part of their active role. And then come back to me if you decide, hey, I want to take care of this naturally, but I
right,
would like them to hear both sides. I think that's very important also in this day and age right now
right. I
for them to
agree.
hear that, to hear. But there's certain conditions that we find out that we can, in functional medicine, that doesn't have to have that referral. We can actually
Mm-hmm.
manage it. And then we retest. There are certain conditions we retest
And you can see
2,
a
3 months.
difference.
And we see a difference, yes.
You do in the markers.
Mhm.
That's
Yeah.
incredible.
It's
So you can see
incredible
the progress.
if the person is accountable to the process as well.
Right.
And so that's the thing. And that's the other question I ask, how realistic is this plan that we're
Right.
making up? Because I always come up with a plan for someone, but is it realistic? If
Right.
it's not, I'm going to have to adjust it. Does that
Right.
make sense? And it's
Yes,
up
it
to
does.
them. I can't, at some point, it's up to them. So inflammation in the body is something that it's really hard to, it shows up in different ways. And for some people, it could show up externally. Eczema,
Eczema.
headaches, aches and pains, stomach aches, digestive issues. It could be internal, it could be external hives. You know, our food is being tampered with, it's manipulated. So whether
100%.
GMOs and sprays and chemicals, and we are vulnerable to some of these chemicals, and those are the ones that what we say rob the receptor sites in their bodies and
Right.
set the stage for conditions to occur.
Okay. So what can we all do? Because I don't know what all my predisposed markers might be. Is there something that we can all universally do that you can say this will probably prevent or at least decrease the likelihood of, inflammation in almost every patient? Is there some two magic tricks that you do or that you offer?
I'd say for sure and foremost, manage stress. Stress is not
Manage
going
stress.
away. We are all
Yes.
living with devices, missed emails, and tracking all of this. Managing perceived stress, because no one's
Perceive
really
stress.
perceived stress. It's all perception, right?
Yes.
And finding what works for you. There's so much available out there, and whether you do something in a formal way or,
Right.
and again, working out is managing stress. Walking in
Exercise,
nature, yes, exercise. So
nature,
yeah,
taking a
so
breath.
you don't have to sit there in the lotus position, although that is
Right.
nice, just to quiet the
That's
brain.
lovely.
That but that is also another way, and that's another way to manage it, to get in tune with yourself, to find that internal sort of balance. Taking deeper breaths. I'm a big fan of that. Drinking water is important. I think that if people just breathe less shallow and really deep and really exhale in a lengthy way, that really does help calibrate and reset sort of the internal stress dynamic.
Oh, I've
Yeah.
been breathing deeper since you mentioned it earlier. Sometimes
Yeah.
you just need to be reminded. It's kind of like hydrating, when you're exercise, if someone doesn't say, "Oh, let's go take a drink of water," you won't. You'll just keep
Yes.
going. So it
Yes.
is all these little things we sometimes just need to be reminded. Just take a breath, take a breath.
Yes.
When
Yes.
everything gets out of control, just take a breath. And I know it's
Yes.
the worst. It's the last thing anybody in my house wants to hear from me. But I say it, I'm like, just take a deep breath. And I've been breathing. Stop. Um, I'm wondering,
Yeah.
what have you learned from your years of experience? And is there any additional wisdom we can learn from your experiences?
Well, I've learned that everybody's unique. Nobody's a
I
page out
agree.
of a textbook. Yeah, I don't have the assumption that you're a page out of a textbook ever, ever,
Hmm.
ever. You
Hmm.
come in with your own sort of um, uh, sort of so you come in with your own unique um, uh, issues and then findings, and and then the tools are unique to the individual too, because just like we talked about, we want to connect the dots, but we don't expect everybody to do it the same way, because we're not the same and not everybody
Right.
can do it that way. So I've learned that being a participant in your own health is key. Some people just say, make me better, make me better. Well, that's the
Right.
medical model, the more mainstream conventional, but
Right.
you got to meet it halfway, because
You need
if
to take
you're
some
eating and
accountability.
drinking, yeah, if you're eating and drinking the wrong things, and your blood sugars are going up, that's metabolic, and there's
Right.
only so much that, you can take pills, that's fine, but not that, that's not going to change, your
Right.
body, your, right. Your cells are
Well,
still going
things,
to be fed the wrong things. Yeah.
that brings me, it's a buzzword today, the, Ozempic and all those things. Now, are those, if I start taking that, because it will change something in me for a little bit, do I have to take that forever? Or is that just I can take it until I lose, the 10 pounds I've been always carrying around, and then I can just go back to my old self?
So that's a good question. And I think we're going to get more and more of these semi-glutides, GLP-1 drugs.
Hmm.
We're going to get more and more um, acclimated to them, and they'll be more and more readily available. I think even
Hmm.
next year. Um,
Is it good or bad though? Because I feel like I wasn't going to diet, but now I can take, a pill and I can have, the bikini body I've always wanted.
That's an injectable. It's not even a pill. It's an injectable. And so, and so I'm watching a few people who have done it. It's not the biggies like Ozempic and Wegovy. There's other names that are coming out now that are not compounded, that are legitimate. And so I'm watching a few people who have done it for a few months, some of my clients, and I'm trying to see if, and now who are off of it and see what happens. So, what these drugs do is they actually curb your appetite. They curb your appetite,
Hmm.
and they
Well,
also
that's
break
good.
down fat cells as well. So that's good. However, if you, once you're off of the, when you're off of one of these, the idea is to not go back to eating the same way, is to smaller portions. And that is another issue we have in this country, is portion control, right? And what's considered,
Right.
and that's
Right.
another thing I do discuss, is what does a regular portion look like. I don't tell them how many pieces, again, of broccoli to put on their dish, but what a plate should look like, what should
Right.
dominate. So
Hmm.
back to the semi-glutide and GLP, that's another conversation in of itself.
Right. Okay. It just came to mind, when
It's a big one too.
when because accountability is so much. Now, I remember you mentioning that with your functional medicine treatment, you also use things like massage and Pilates, and these seem like stress managers. Um,
Exactly. Yeah.
I I really appreciate that. But those are things that we can do together. I can come to you, and as a practitioner, you can provide a Pilates reformer and a massage therapist. This I
And
really
it's
appreciate the
And that's covered by insurance in our practice, both Pilates and the reformer and massage from Amosin Insurance.
unbelievable,
It's wonderful.
unbelievable.
And when someone comes in, for instance, with an ongoing ache or pain that's been persisting, that is exhausting, to be in pain. And even when they come in and at the same time they say, I want to do both. I want to come in and resolve my pain, but I want to do functional medicine. I always start them with, let's take care of the pain first. Let's take that down. And then you'll be better able to receive that internal balance. Let's deal with the physical balance. Let's take that edge off. And then it'll be time to say, okay, what's going on my insides? Because that's a lot to do all together. But yes, stress, it's certainly with massage, it takes about 10 or 15 minutes to quiet the brain. And then part of the massage is that quiet me time. It's therapeutic for sure. But I think, to me, one of the advantages is to really quiet that brain.
Mm-hmm.
It is
Mm-hmm.
meditative, and that is helpful too in healing. The
um,
loop, quieting the loop.
Quieting the loop. There's always a running list in my mind that,
Right,
did you do 1, 2, 3, 4?
right.
It's like, and sometimes
Never.
I run through the list, like, do 1, 2, 3, and 4 before you can get out of the house. And
Always, always.
there's always one more thing to add to the list. Oh, Natalie, thank you.
Yes.
I have one more thing. I have the Source and Self speed round. Now, just have fun. Don't overthink it. I'm just wondering what you are doing, what you are into, things that you can share, that and we can all use another bit of fun and something light in our lives. So share 2 things that you're loving right now.
I love hot yoga,
Hot yoga.
and I love reading more and more about epigenetics. We just mentioned that.
Epigenetics. Oh, we could have a whole episode on it.
Yes.
If you'll come back, that would be great. Um, what are you reading right now?
What am I eating?
Reading.
Oh, reading. What am I reading right now? I'm reading a book by Strauss and Howe
Mhm.
called Generations, and they also have one called The Fourth Turning,
Mm.
about how history every 80 years or so kind of repeats itself. More of the
How,
macro of what's going on in this world today.
wow. Wow.
Mhm.
How relevant. Um,
They
what?
coined the term millennials, these guys.
Okay.
Yeah, yeah.
Oh, terrific. Oh,
Mhm. Yeah,
terrific.
yeah, yeah.
Are you reading in French or English?
In English, only
Okay.
English, yes.
Very good. What is in your ears? What music are you listening to?
Oh, good question. I listen to a variety of music. I'm actually a collector of music.
Ooh,
Uh,
I didn't know
I
that.
I love whenever I find a song that makes me feel good, or I listen to music and I like it. I will download it and keep it in my lists. I
Right.
also have a dancing list, so I
A
have
dancing
great.
list.
Yes, I do.
What a great way to relieve stress.
It is, and I think that is another wonderful way. So, in particular, I'd say it's varied. I just so many. I'd have to look at my phone and see some of the names, but yes, just so varied. Yeah, yeah,
Now that the cooler weather is upon us, what
yes.
are you longing for? What do you fill in the blank?
Mm. What am I longing for? Um, I'm longing for. Well, I do love the summers, so I do love the beach. So I long for the beach.
Right. So that brings me to, how do you protect your skin?
I do use sunscreen. I have skin that tans very easily and very quickly.
Right.
I mostly use sunscreen on my face. I
Right.
use some on my body. I don't reapply it. I do believe that vitamin D is good for us. So I do a lot of gardening, and I typically do
Wonderful.
not wear a lot of sunscreen when I'm outside gardening, but I'm not directly in the sun at all times either.
Right. Right.
Mhm.
What are you eating right now?
So I love making, I eat a very varied diet, but I do make my own oatless granola. I just made a
Ooh,
batch this morning.
that sounds lovely.
It's one of my favorite gifts to give to in a big ball jar around the
Oh, how
holidays.
lovely.
I made another batch with oats, and maybe I'll drop some off for you, Abby.
Oh, I'd love that.
And I have my own recipe, and I make it's actually avocado oil.
Ooh,
Do you want the recipe? Really quick.
sure.
Avocado oil, organic maple syrup. I put some Himalayan salt in there, some
Amazing.
vanilla, and cinnamon is the other trick. I mix it all up, and then I create just a bunch of nuts. I
Yeah.
use slivered almonds, sliced almonds rather,
Oh, it sounds.
pecans, walnuts, pistachios, varied nuts. Mix it all in there, and then I bake it in the oven.
Oh, how
Comes
lovely.
out. So it's my favorite thing I like to do, but I also use it as gifts as well. It's one of my favorite gifts to
Your
give as
home
well.
must smell so good right now
It
because you
does.
just made it this morning. It must
Right?
just smell like, warmth and delight. Um, is there any advice you'd give your younger self?
Don't take things personally.
Don't
Um,
take things personally. Yes,
Oftentimes, and this is the one thing my soon to be 20-year-old has said to me, sometimes it's a them issue, right? And in anybody,
100%.
in every interaction, people are master projectors, and I do it too. We all do it, right? And to
Yes, of
just
course.
not be so people, everybody is going through their own thing. And so if my younger self knew that, that would be great, because I feel like my older self kind
Right.
of adopts that idea, right? But it's
Yes.
not
Don't
always
take it personally.
personally. Yeah. Unless it is, that's a different thing. But I mean, just in general, yeah. Yeah.
Oh,
Yes.
well, that's it. Thank you so much, Natalie. I appreciate you being here so much. I hope we do get to talk again about epigenetics. If you would give us more of your time, I would so appreciate it. But thank you. Thank you for joining us on Well Informed.
Well, this was my pleasure, and thank you. Thank you for having me.
Oh, it's so fun to talk to you.
You too. À la prochaine.
Well,
Until
I'm
we
sorry.
à la prochaine,
Yes, until
which
we meet
means
again.
until we meet again.
That was my high school French.
But you knew it. You got it.
Thank you, Natalie.
Thanks again too. Bye-bye.